pain. It is a feeling we cannot avoid in our lives. When we are injured, after surgery, or due to a chronic illness we have lived with for many years, we have relied on many medicines to alleviate this suffering. However, behind this lies a serious social problem in the world, particularly in the United States: the opioid crisis. Opioids, while possessing powerful analgesic effects, also carry a high risk of addiction and side effects. Many people have had their lives ruined by drugs they began using to alleviate pain. Is it possible to eliminate pain powerfully without causing addiction? In 2026, a definitive answer to this long-standing question for humanity is finally about to be revealed. CARES, a world authority on chemical information, has published its 2026 Trends to Watch. One of the most important developments highlighted is the rise of new non-opioid analgesics. Today, we will delve into the true nature of these new era analgesics, which have the potential to rewrite conventional medical wisdom. Before we discuss the new drug, let's first review the mechanisms of the drugs we've used so far. Currently, the most common drug used for severe pain is the opioid. Morphine is a well-known example. These act on the central nervous system, such as the brain and spinal cord. By binding to receptors in the brain, they forcibly switch off the pain-sensing receptors. However, this was the problem. Opioids don't only act on the areas that control pain, they also act on the areas that sense pleasure and reward, causing the brain to intensely crave that sensation, leading to addiction. They also had serious side effects, such as suppressing respiration. On the other hand, NSAIDs like aspirin are not addictive, but they lacked the power to suppress severe post-surgical pain and neuralgia. In other words, there had always been a gap in the medical field. The ideal drug, one as potent as opioids, yet without the addictive properties of NSAIDs, was missing a crucial piece. The target that scientists worldwide are now focusing on to fill that missing piece is Nav 1.8. It's a technical name, but simply put, it's a type of tiny pore called a sodium channel on the surface of our nerves. When our bodies sense pain, they send electrical signals to the brain. These sodium channels act as gates for sending those signals. Among them, Nav 1.8 has the unique characteristic of being concentrated only in peripheral nerves, the site of pain. This is the most important point. Because it is almost entirely absent in the brain, blocking it has virtually no effect on the central nervous system. In other words, it becomes possible to block only the pain signals at the site without interfering with the brain. This theory is embodied in the innovative new drug suzetrigine, approved by the FDA in 2025. Suzetrigine selectively inhibits Nav 1.8. Clinical trials have shown that it significantly reduces pain compared to placebo in postoperative analgesia involving severe pain, such as in abdominal reconstructive surgery. It purely closes the tap of electrical signals representing pain without causing brain drowsiness or addiction. This is why this new analgesic is called a revolution. How will this new option change our healthcare practice? First, we can expect a dramatic change in post-operative care. Until now, after major surgery, patients were faced with a choice: use opioids, accepting some risk of addiction, or endure the pain. However, with the widespread use of non-opioid analgesics like suzetrigine, we can block the very entry point to addiction. Furthermore, it offers a ray of hope for people suffering from chronic pain. For patients who must take medication for extended periods, the reduced risk of side effects and tolerance makes a crucial difference in maintaining their quality of life. Of course, not all pain can be solved with a single pill. There are various types of pain, and multimodal analgesia, combining existing medications, will remain important in the future. However, the increase in non-addictive, powerful options represents a significant step in the history of medicine, perhaps a century in the making. The era where enduring pain was considered a virtue is becoming a thing of the past. In 2026, what we will witness is not simply the arrival of a new drug. It is the moment when the power of chemistry and medicine is poised to put an end to the long-standing trade-off between suffering and addiction that humanity has grappled with. This trend, which KS is focusing on, will accelerate further in the coming years, potentially changing even the lineup of everyday medicines we keep in our homes. A future where non-addictive painkillers are commonplace. In that future, many people will be able to walk the path to healthy recovery without fearing addiction. The latest science is evolving somewhere today to make your tomorrow just a little easier. Thank you for watching. We hope this new dawn in medicine brings relief to everyone.